All right. Thanks everyone for taking the
And just let me
time.
know when to advance.
Can you all hear me? Can you hear me, Brad?
Yeah, just let me know
Okay,
when you want me to advance the
sure.
screen. Thanks.
So just want to thank everyone for taking the time to join us. Really excited this year to share some information that I have for our 2025 U65 line of business. I think you're gonna love this. And so looking forward to a great year. The purpose of this presentation is going to be focused in Ohio, Kentucky mainly, but I will be able to provide you information about our other states. We'll be kicking off in e-blast for those of you who sell outside of these two states in the next few days. So look out for those. Please join those at your convenience. Again, thanks. I'm gonna go off camera, and Brad, I'm gonna ask you to control, I guess, the slides and
Yep,
let you know when you switch. Okay, if you can go
yep.
to the first slide.
Is it the
Uh,
title slide or the scan here
well, let's
slide?
yeah, no, the second one, the scan here, the QR code.
Yep, you should
Okay,
see it.
so uh, all of you that are on this call right now, if you could just scan the QR code here, it will help us track those who are participating. I would appreciate you doing that. I'm sure I'll get a list of all participants from Brad, but I'm trying to test how this works as we do these virtual trainings. I want to make sure we're able to track also on our end all participants. My contact information is also here for you, so feel free to reach out to me if I'm not able to answer your questions this morning at any time after this presentation. I'll give you 10 seconds I get to scan. Hopefully, many of you have already scanned this QR code. All right. Again, while I am directly responsible for Michigan, Ohio, Illinois, South Carolina, and Wisconsin, that's a lot of states. For Molina under 65, I am also your national contact for any other states. My counterparts will represent each of these other states that are outside of my territory. We'll be kicking off presentations for those for their specific state, but you can always come to me as well to any Molina for information for any Molina state. It's a little bit about Molina. This is a little outdated. It's been updated. I don't have the most updated slide, but it's pretty close enough. So we're ranked 126 on the Fortune 105 list, and currently 5.2 million members in the three lines of business: Medicaid, Medicare, and ACA. We're headquartered in Long Beach, California. We were established in 1980. Currently, we employ upwards of 15,000 people across 21 states. This is information that you all know. 2025 open enrollment will kick off November 1st and will end January 15th of 2025. Um, Cover California, for those of you who do California, runs from November 1st through January 31st. And then the state-based markets such as Kentucky has a different timeline, October 15th of 2024 through December 15th of 2025. Oh, are you, Jeff? I didn't ask you to move the slide. I'm moving on my own on this side, but I know hopefully you're. Can you just confirm, please, that you are going along with me? I didn't ask you to move the.
Kahassai, sorry, I went off mute
No,
or on
no,
to
no.
mute.
Are
So
you are
good.
you
I'm good.
following me on the slide? I didn't ask you to go to next slide. I'm sorry. I should
Okay,
be
I
on the
am
one.
on 2024 open enrollment period.
Perfect. Let's go to the next one.
Okay.
So on this next slide here, we're going to go over our 2025 footprint. Let's go to that next one. This is our national footprint. We are expanding in four states with into new additional counties. However, no new states in 2025. So in Kentucky, we're expanding into additional five counties. Florida in five counties. Ohio into 15 counties, bringing our total footprint in Ohio 78 counties. In Texas, another 10 counties.
That's
So
amazing.
as I said, next slide here, Ohio and Kentucky will be the focus of this presentation. but I'll be sure that you get additional information for other states next time.
Yeah, and everybody, once Kasai sends me the PDF, you will receive a follow-up email from Cornerstone, and it will have a link to download Kasai's PDF of this presentation. But
Okay.
that's some nice looking expansion.
Yeah. So I'm really excited about Ohio this year. Um, our price positioning is maintained. In fact, we dropped by percentage points. Plus, we're expanding into additional counties, and I have some other exciting news for you when we're bringing back the bronze option in Ohio. So that's really exciting. One of the counties that I'm really excited about is really Delaware County. That's been a huge ask in the past few years, and I'm happy that we're able to expand into Delaware County. I think all of these counties are going to be great, especially the counties that are contingent to some of the major metropolitan areas, is the central Ohio ones, Delaware, close enough to Columbus, expanding on the southeastern part of Ohio. Marion is a good one. So we'll see what comes out of this, but I think we're positioned based on product design, pricing, and network to really succeed. We've done well for the past 3 years. I think this is a continuation and proof of Molina's success in this market, and also our goal is really to be in the entire state by next year. So you can expect more expansions in coming years. Our network, this is the same that I sent out last year. So remains consistent and throughout the state, but I will have an update for the expansion counties, which are not listed here. So just to go over a couple areas here. Central Ohio still remains based on Ohio State University Medical Center and the James Cancer Hospital. And the only county where will not offer the bronze option is going to be Columbus. And that's still the way it was in the past. Everywhere else will have the bronze option. I think Hamilton County and in Cuyahoga County, the bronze option will be a huge hit. I'm sure in other areas as well, but in Columbus, we will not have that option again due to our contract with Ohio State Medical Center. And Hamilton County, Cincinnati market is going to continue to be based on Kettering, the Mercy Health System, and University of Cincinnati. All of these hospital systems are listed here for you. In Cuyahoga County, will continue to carry Lake Health, Metro Health System being the major hospital system, and Southwest General Hospital. And as you can see, I'm not going to go over every single county here. I will update this to include the expansion county since when sending this out. Um, Also, one thing to mention, as I've said in the past, Molina's network is available to all members regardless where they live. So you can have someone in Cincinnati and they need access to the James Cancer Hospital, they will have access to that. You're not limited by network within your county. Not only that, on the border between Kentucky and Ohio, border between West Virginia and Ohio, we have hospitals in Kentucky, such as King's Daughter Hospital in Ashland, Kentucky, that will be available to our members, ACA members, as well as the list of hospitals here that I've listed for West Virginia. The only exception, if you have the bronze option, Central Ohio State will not accept you. That's the only exception.
Okay.
Moving on to Kentucky 2025, we're expanding into additional 5 counties. So Kentucky is going to be an interesting state this year. Obviously, the challenge in Kentucky has been the fact that it's a state-based market and their Connect enrollment platform is not the best user-friendly. So outside of that, I think Kentucky, Molina is set up to do well. One of the largest ACA carrier in that state is actually pulling out of like 20 plus counties. And so I think the play is going to be honestly between Molina and Ambetter. Molina has the network sufficient enough, adequate network, as well as we're expanding with pretty pretty good product options. Next slide here is the Kentucky Market Hospitals list. Our network is currently based on University of Louisville and the Norton Hospital System. Now, we will have additional hospital and provider network improvement expansion counties. I don't have that ready to share with you, but I promise to have that added to these slides when I send it out. I'm awaiting an updated list from my provider contracting team. Value basics, these are pretty much the same as last year. We'll continue to have the no-cost 24/7 telehealth virtual care services, which is unlimited for our members. No-cost member wellness incentive program with incentive $200 for members. That will continue for anyone 18 and over. No-cost preventative prescription drugs. No-cost preventative screenings for children and adults. No-cost pediatric vision services for anyone under the age of 19, which is administered by VSP, and it gives our members $150 allowance towards glasses, frames, and contact lenses. And we kicked off last year the no-cost RX savings solutions. And that's going to help members with prescription savings and no-cost 24/7 nurses advice line. We renamed our member benefits to be called Member Wellness Incentive Program. So the Molina Healthy Reward, it recognizes and rewards members who are taking steps towards better health. It contains interactive programming to help manage your health and wellness. It offers $200 wellness incentive program, and it provides a sort of health tools and programs. Now, members 18 and over can participate in this, and they can receive gift cards in increments of 50. So, for instance, if they get, a CVS gift card or even a Visa card, is they can get it and $200 once they complete, or they get an increment of $50. So anyone 18 and over for completing a wellness assessment and completing their annual physical with their PCP. All right. Next slide is the RX savings solution, which I just mentioned. This is a very good program that will help members save on prescription. Guidance on how to access this benefits through my Molina, and activation of their account is going to be sent out to each member, and contact information for RxSS will also be provided, and their 800 number is here listed for you. And next slide is on our product design. All right, this is an overview of the portfolio that we'll provide by step by step. So let's look at Ohio. So we'll continue to offer the Silver One with adult vision option. It's going to have its variations: Silver One 100, 150, 200, and 250. And then the Silver 8, which is the CMS standard option, that will not have the adult vision option, but that is a required plan that we have to offer, and that will be the Silver 8. Silver 9 is only in Florida, and Silver 12 is the new plan that we kicked off last year. This is a low-cost plan that offers members 4 free PCP visits per year, and it's a very good option that will be available in Ohio. When it comes to the Gold, we'll have the Gold 1 and 2, and then we'll have the Gold 8, which is the CMS standard option in Ohio. And with the Silver, there is an error here. So we will not be offering the Bronze 4 in Ohio. That's a mistake, the fact that line is checked. We will offer Bronze 8, Bronze 9, and Bronze 10 in Ohio. Kentucky will continue to be consistent as last year, same as last year. So it's the Silver 1 with this variation, the Silver 12, and the Gold 1. No bronze options in Kentucky. All right, so just to go over the basics here, and I will have the benefits at a glance. It is not available. This is, mind you, the first presentation I'm doing for this year. In fact, the actual official presentation decks are not out yet. So this is something that I just put together for this purpose. We should have that done by end of this week, and I'll make sure, Brad, that I send you that final version to be posted on your site for people to
Yeah,
upload. So the
perfect.
silver
Yep.
one is intended to as a buy-up option for consumers over the silver 12, offering more co-payment cost sharing, along with lower medical deductibles or out-of-pocket max. Silver one retain members and is a cost-friendly, share cost-friendly feature such as co-payments on primary care, specialist offer, office visit, urgent care, PT, ST, and OT for labs and X-rays. So quite a number of the benefits. When I send you the at a glance benefits at a glance, it's going to show you where we actually waive, as we've done in the past, deductibles on quite a number of these services. Silver 9 is only available in Florida. The Silver 12, again, it gives our members for free visits to a PCP. It's a low cost option. Nothing has changed, so it will remain consistent. And obviously, the Silver 8 is the Molina, the CMS standard option that we will be uh, offering. That's the standard silver, which is Silver 8. All right, next slide here is the gold option. Again, similar to last year, we'll have the gold one with the adult vision option, gold 12 with no adult vision option. Instead, the one is going to have gold one and gold two. And that's the two is with the two is with no adult vision option. So the out-of-pocket max on this is pretty low. In fact, last year in certain counties, some areas in some states, the gold actually was better price, and actually it did better than some of the silver options. A lower prescription cost, especially on generics and tiers 1 and 2. And then we'll offer the standard gold, which is the CMS standard option. This is on a national level. The bronze option, again, the bronze 4 is only in Florida and Mississippi, not in Ohio. That was an error where we checked it. The deductible on this runs from zero, but there is a $3,000 medical RX deductible. Then there's a bronze 9 in Ohio. None of these will have the adult vision option, the bronze 10, and standard bronze, which is the CMS standard option. So this is gonna be a very welcome option, I think, for many members who are seeking. Many agents will actually sell a lot more. 65% of in the Hamilton County area, 65% of all ACA sales were actually bronze option. So this is certainly going to help Molina
And
meet the market demand.
and Kahassai, let me just add. So, gang, I was invited to a general agency roundtable in Miami over the winter with the Molina team, the executive team, and product. And this was one of the things that they said, what can we do to improve growth? And I'm like, you have to add bronze because um, it's viable option for low utilizers who are also looking for value in premium. So I need you to help me back me up and sell a little bronze so Brad doesn't have egg on his face next February, March when he goes to Florida again to say that it didn't work. But I really think it's a
we
viable
we
option.
we listen to Brad and we listen to you, and we're gonna make it happen. I think this is certainly gonna sell it, and it's priced very well, so I think it's in demand for sure. So
Yeah, yeah.
we'll
With
see.
a $2,850 deductible, that's very affordable.
Yeah,
And then, I mean, if it's really helpful. I
yeah.
think that the way they've designed it, they have a low, a medium, and a high with the standard. So I think it's really, really viable because, again, Molina and I learned something new then. Molina, their whole mantra is about serving the underserved, right? And so silver plans were important because a CSR or cost share reduction often happened with that. And I said, well, what about everybody else who doesn't get a cost share reduction but wants a viable plan at a low cost? And so hence the bronze. Please sell the bronze so Brad doesn't look like a rogue actor next winter in Miami. So carry
Yeah.
on, Kahassai. I just wanted to
All
interject
right.
that.
Now, thank you.
Yeah.
for filling in that. All right, so nothing has changed as far as our provider directory. Again, the only thing I want to say here is just remember that Molina has three different lines of business. So when searching, just remember to search under marketplace network versus and make sure you're in the correct state versus selecting Medicaid or the Medicare because the networks are completely different. So be sure that you are searching the correct line of business. Evolve that was kicked off early last year. I think that was definitely a needed improvement, and so you guys are able to order member ID cards. You are able to assist your clients with PCP change. You have access to the digital member handbook. So this should be working out very well. We've gotten really great feedback from many of you, but continue to give us any feedback you have. But I think we're set with the broker portal here. When searching, if you are not familiar with the Evolve, when searching for your book of business, once you go in, log in, uh, just click search, and that's going to bring up your entire book of business once logged in. So you can filter it by effective date, pay through date, net due amounts, and pending termination dates. Once OEP kicks off and you're adding more members. This is just a platform for how you order the member ID card and change primary PCP. The broker portal, again, if you attempt to log in and you're locked out, please feel free to reach out to broker services or you may reach out to me. I can help you reset it. Just shoot me an email. I'll reach back out to you, or you can call me on my cell phone, and I can certainly help you reset your password. Sometimes you may have forgotten your password, but if you click on the forgot password, you should be able to do it. Just in case, sometimes with technologies, you run into a problem not being able to do that. Just let me know. All right. Improvement in member experience. So actually, we've kicked off this year. We're going to be kicking off quite a number of tools to engage members. So we'll be sending out our welcome kit over how to a multi-platform onboarding experience for new and renewal members. So the physical mail that will be sent out to members, including all of the information they need, their member ID card, website, and quick start guides. And every mailer that we send out is also going to have a QR code for members where they can scan that QR code. It's going to take them directly to their member portal and follow the instructions to be able to create an account. And also, there are going to be various videos, educational materials available for members. Members are going to be able to text. If they text messages, they can give us permission for us to text them information if they provide us a cell phone number. So significant improvement. Member satisfaction survey will be kicking off as well. We'll be sending out 7,500 to weekly to 7,500 members. Not only that, as members also leave Molina, we're gonna have launch a leave survey to learn why members are leaving, and that's gonna help us, make the improvements necessary. This is just the basic information on the member mobile app. Again, QR codes will be included. This is going to give them access to all of their information on one secure place, access to digital member ID card, premium payments, medical records, and more. Our member ID card hasn't changed, just to give you a visual what it looks like. We do include the cost, the tiers 1 and 2, and then also the deductibles and RX individual deductibles will be posted on this. Our pharmacy vendor will continue to be CVS Caremark, and number the important information on the back, the phone numbers for member services, for provider services, and medical claims, and billing and payments information is also listed on the back of the card. The MolinaMarketplace.com site is where you need to go to have access to all the plan information, to be able to toggle between 2024, 25 plan information. You are also able to access forms and documents such as the evidence of coverage, summary of benefits, formulary, the benefits at a glance type of stuff. So CVS mail order forms also available. Everything you need is a one-stop shop on the Molina Marketplace.com site. All right, so we have quite a number of payments. This hasn't changed. Continue to offer our members. Obviously, you want to set up recurring payments and auto pay. Members have access to making payments online through bill pay, by phone, by calling the customer service support number listed here, by mail, but they will have to allow 10 to 15 days for mail receipt. And they can walk into any local MoneyGram location to make payments. The two additional new payment forms that we are offering is Apple Pay and Google Pay. And these are definitely good for some younger population. So what to expect following a binder payment? With enrollment and premium billing, binder payment, the 800 number is listed here. If members make
Wait,
payment
Kasai,
before
I have to advance. So a lot of people want a credit card payment. So the way to do that is through Google Pay and
correct.
Apple Pay, where their connected credit card will get billed. So that's a way for them to utilize credit card as a payment option using
Uh,
these two services. Okay, I just wanted to interject just to be
yeah,
clear.
thank you. Yeah.
Yep.
So if members make payments before 5 p.m. Eastern Standard Time, it loads into the Molina member database following business day. If after 5 p.m. It batches it to with the following day for enrollment feed from enrollment and premium. So it takes about 24 hours for us to get the 834 file from CMS. Molina Member Services only has line of sight once the coverage has been effectuated and policies loaded. Uh, Prior to that, we won't have access to any of that information. Molina loads member profile, removes restriction, creates Molina member ID card. ID card, as I discussed earlier, are sent out to members within 7 to 10 business days after binder payment is made. All right, so broker bonus and commission. We will offer bonuses this year, but I wanted to share with you some of our commission, street level, agent level commissions for this year, which is great. In Ohio, we're increasing our street level commission from $16 per member per month to $20 per member per month. In Kentucky,
Yay.
yeah,
25% increase, everybody.
yeah,
Again, another thing you asked for, and so
and we
I
made it
asked
happen.
for you.
Kentucky, $18 PM to $20 PM. So as you can see in these states, we're increasing significantly in Florida from 25 to 27, and Mississippi from 18 to 22, and South Carolina from 19 to 25, and Texas from 22 to 25. So this is street level commission. This is what is paid to the agent per member per month. So definitely with the bronze back, with commission increase, we're gonna have great bonus structure for our brokers, which will be kicked off probably a couple weeks prior to OEP, and we'll be sure that you get a hold of that. Really, Molina's position. We are in a growth mode, and we look forward to growing this year in all of our markets.
And
Here's the
also
contact.
Illinois there, gang. I mean, since Illinois is in the region and some of you, cross into that state line, again, another 25% increase going from 20 to 25. And I
That's right.
believe, just because there's expansion also in
In Illinois,
Illinois, if
yes.
I'm not mistaken.
I didn't include that. Yeah, we are.
Yeah.
Well, no, we're not expanding in Illinois, but Illinois is going to be a very good market as it was last year for Molina. We are adding a major hospital system called Advocate Health, which contains upwards of 10 plus hospital system in the vicinity of Cook County, Chicago market, which extends into some of the surrounding counties. We're in 5 counties in and around the Chicago market. Now, those 5 counties are actually represent about upwards of 85% of all ACA population. So those are the most important counties.
Yeah.
Yeah,
Yeah.
for sure.
Chicagoland.
And and so when I here's what we'll do, Brad. When I get the final uh presentation decks for 2025 for all
Yes.
states, which should be by the end of the week. I'm gonna wait to send it to you by the end of the week or first thing next week, so that way you have the final one and you can just post that for everyone
Yeah.
because we don't
And
know who sells where. So
yeah,
uh,
and gang, we'll send that out. So you may get a reminder for the video recording. We'll wait to send the follow up with the actual link for that the updated presentation. But Kasai, I know the national team also does a presentation
yeah,
probably in a few weeks, right? And
yeah.
so
Well, I'm
I would
actually going to be
encourage
doing
you all to
national
join
ones.
that. Oh,
I
nice.
will also
Okay.
be kicking off national presentation once a week through the end of uh, October.
Okay, good. So
All
yeah,
right.
if you can join the national presentation, it's a really great presentation with the product team and some of sales and corporate leadership as
Yeah.
well. So I joined it
Correct.
last year. It was pretty amazing presentation.
Yeah.
Talks about competitiveness by market. So all around good. So glad you're here to get a preview so you know how important Molina will be for 2025. So
And as soon as pricing is official, as we've done in the past, we'll create a heat map per state, per county, and show you where you need to really look at Molina seriously. So you'll have that roadmap.
good.
Contact information for broker services remains the same. So option one is broker services. Option two is the care team. And the commission team is option three. And the contracting team is option four. Their
So
email is
definitely
also
take a
right.
photo of that slide.
Yeah, yeah. Please do.
Yeah, yeah. And then here's member services coming up.
All right. Member services. Molina has unique member services number by state. So if you have a client from Ohio, you want to make sure you give them the 888-296-7677. For Kentucky, it would be, what is Kentucky? 833-644-1621.
Yeah.
All right. Our great director is Fabian for all states, national director. Aldo, if any Spanish speaking agent that or agencies here that you want materials or you want presentation in Spanish, Aldo is going to be kicking off e-blasting his presentation schedule for Spanish. Please join him on those. Lindsay represents Florida, Mississippi. I represent Ohio, Michigan, Kentucky, Illinois, South Carolina, and Wisconsin. We have Gene, who is over New Mexico and Northern Texas. Gabe is over Southern Texas and Nevada. And Casey is over the state of Washington and Idaho. Andrea is over California. That brings
Great.
me to the conclusion of this presentation. I look forward to your questions and a great year.
Yeah. And Kasai,
Thank
there are
you.
some questions. I'll read them to you to let you answer.
Okay.
Yeah, Whitney, you're going to get a copy of actually a more expanded slide presentation
Yes.
next week in all likelihood. Again, Kasai has a family issue. He's out of state, so we're going to give him a little bit of time to do that. Um, John, on the PMPM, the max is still 5. Is that correct?
That is
Of
correct.
commission
Good
pay?
question.
Yeah,
That is
good.
correct.
Okay,
So the max is going to be per app up to 5 members you'll get paid,
right. Yeah,
which is actually pretty
and
good compared to
yeah,
what I've seen.
yeah,
In
yeah. Some of the others are actually less than that.
correct.
Um, then also, commissions are the same for renewals as new, correct, Kasai? Whether
Yes,
it's new, newly enrolled or renew, it's the same
new
commission.
renewal and SCP will be the same.
Great, good to know.
Yep.
Can a member in Ohio go to a hospital in network. Hang on, I need to expand this. I think I know where that question. In network in Kentucky or other states.
I would say not. In Kentucky, yes. Into hospitals that are in network, okay. And but an Ohio member on, say, someone in the Toledo market, right, or somewhere close to the Michigan area, that is not true. So because we don't have that contract with the hospitals in Michigan to be able to see our members from Ohio, and vice versa. But West Virginia, even though it's not a Molina state for ACA, we have hospitals contracted on the border to address the needs of our members, on the across the Ohio River for communities that are close to the West Virginia border. So it's yes and no, but it's limited to Kentucky, really.
So
Otherwise, no.
Kentucky members can go
And so a Molina
into
member
Ohio.
who may visit, who may be in Florida, will not have access to the hospitals. Now, in case of an emergency, obviously, they can go to any hospital. However, not for routine care.
Okay. So Kasai, let me ask this specific question. We have a Kentucky member who wants to access the Ohio network. Say they want to go to Columbus to Ohio State Medical or James Cancer. In that case, will they be able to do that as a Kentucky member, or are they really only able to go to Cincinnati hospitals or those that are just across the river?
Kentucky members, it doesn't work the reverse way. So
Okay.
I think in this case, what Molina did is, so if you look at Lawrence County in Arlington, Ohio, you have Ashland, right? Ashland, Kentucky, and then King's Daughter Hospital has facility both in Portsmouth, Ohio, and Lawrence County, Ohio, and Arlington. So it's really to accommodate. It's a unique arrangement that we made to accommodate the needs of our members, specifically in that area. Now, if you look at the Kentucky members and other parts, Louisville members will not have access to Ohio State University Medical Center. That's just not uh, practical, and uh, that's not the way it works here. This is unique to southeastern Ohio members that are on the West Virginia and Kentucky border
Got it. Only
only.
Southeast Ohio, West Virginia. Got it.
Correct. So
Good. Okay.
it's typically the hospitals that I've listed in the decks representing West Virginia and Kentucky.
Got it. Okay. We've got another question regarding medications. What medications will Molina and CVS Caremark cover for weight loss for insureds who are not diabetic? So this is the Wegovy type medications. I can never pronounce
Uh-huh.
what their drug name is. So is Wegovy and I think there's semaglutide. No, that's not right. You know what I'm
Um,
talking about? All the highly advertised
yeah,
medications.
so I don't have an answer for that off the top of my head, but as you enroll, if you go into the Molina Marketplace website, you can actually look up covered medications. You can type in the medication's name, should be able to provide you. If you're not able to get the answer to that question, I cannot answer that question right now, right away. But shoot me an email, whoever this person is, right, if you want to send that to me. I can look it up and send
Okay.
it out to everyone.
Okay. That sounds good. Let me just make a note. Give me a sec. Post it. That was it for the questions. I see, unless anybody else has something coming in, got it. I see that. Thank you. Um,
Yeah, I just want to say, Brad, and to everyone that is on this call right now, I don't know how many people we had. Hey guys, I really thank you for joining, but this is the first one that we're doing. We're gonna have a lot more of these. Please rejoin, and then we'll be sure to post the final version of this presentation for you to access, and we're gonna be e-blasting these as well, so you'll have access to them. Let's make it a great year.
Great. Thank you, Kasai. Really appreciate you being on here. I know under the circumstances it's difficult to work remote. So just appreciate you on not canceling
Oh
and,
no.
and joining us today. I know you would never, because
Yeah.
Cornerstone is so important
Yes.
to Molina's network of general agencies. So we appreciate that partnership we
Absolutely.
have with Molina and Kasai, especially. Every time I call him, he answers with your questions or your issues that we have. So Kasai is a really great partner, and I appreciate him wholeheartedly. So again, all of you, we're going to give you a little bit of time back and not consume the whole hour. So appreciate you all joining. This is a very well attended presentation. So, look forward to more of these every Tuesday. We'll have them, I think, now until mid-November. Every carrier will be represented. Um, but also look out for the individual carrier presentations. This is recorded, so if you missed anything, you'll see that recording email come out tomorrow, and then we'll do a follow-up with the presentation probably early next week when Kasai gets back to town. So
Okay.
thank you all very much. Have a great day and a great rest of your week, and we will see you again next Tuesday for another carrier presentation. Kasai, you take care of yourself and
All
your
right. Thanks,
family,
Brad. And if you
and
wouldn't
you got,
mind sending me the
yep,
list of participants, will be great.
yep,
Appreciate it.
sure, you got it.
Thank you.
Thanks,
Thanks,
everyone.
everyone.
Bye now. Take care. Sure. Bye.